Hello, how is everyone doing today? Welcome to another episode of Let's Get Vaccinated. Now, I know it's April 1st, right? But don't worry. Okay. Well, I don't know what that was, but anyway, as I was saying, if you want to shelter from April Fools, you've come to the right place, because here each week we give you a healthy dose of science and facts. Now, if you don't know me, my name is Lucky Tran. I'm a biologist who works in public health communications at Columbia University in New York, and I'm the managing director for March for Science. So on Let's Get Vaccinated, we do two things on this show. One, we answer your questions about vaccines and the pandemic, and we all learn how to effectively communicate science. And no, you don't have to be a scientist to do this. This is for everyone. And we focus on these two things because we think that sharing science is how we keep our communities safe. This is an interactive show, and we'd love to get to know you all, so please do write to us in the chat. Please let us know where you're from, how you're feeling, and leave us questions. And don't forget to subscribe to us on YouTube, because that's the best way to stay in touch with us and participate in our community. We'll leave the link in the chat. All right, I am excited to introduce this week's guest, Dr. Linda Girgis, who is a family physician based in New Jersey, a clinical assistant professor at Rutgers, and an organizer with our partners, This Is Our Shot. Hey, Linda, how are you doing?
Good, how are you doing? Thank you so much for having me here today.
Yeah, I'm doing great. Excited to have you on, and thank you so much for joining us today. So, yeah, I got to ask, how is New Jersey doing? I know, I'm here in New York, and here in New York, you're seeing a rise in cases again, right?
Yeah, I think they said we've had a 25% rise in cases over the last 2 weeks, so we are still seeing a lot of COVID around here.
Yeah, so we got to keep being vigilant and careful. Yeah, absolutely. Now, Each week on the show, a big part, as we said, of this show is to help learn about how to communicate about health and science. And you've been doing a bunch of this work with media and social media during the pandemic. So just wondering if you can help share some challenges that you've encountered and some lessons that you've learned.
I think there's a lot of misinformation going out right now. And because the COVID vaccine is so new, we don't have a lot of data yet. We're still getting it as we go along. I find we have to understand where these myths are coming from. They may seem completely unreasonable to us, but some people, it's reasonable to them. So we have to understand why they're believing these and how we can help them to understand what's actual and what's not.
Yeah, absolutely. And I think a big part of this, as I say, I know we do lots of things like social media, but really, and definitely your role as a physician every day, it's really about listening and conversations, right? It's a two-way street. We really want to hear concerns of people, and we want to help address those concerns so that they can help get information from good sources. Yeah, in the chat, thank you for telling us where you are. We have people from the US, we have Betty from Canada, we have Elias from Dhaka, Bangladesh. Welcome to the show. Ask us questions in the comments. All right, and so on to speaking about addressing concerns. On this week's theme, we're talking about side effects, allergies, and what to expect from getting a COVID shot. Thank you to everyone who left questions. We're going to address them here. And if you have questions right now and you're watching us right now, please leave them in the comments and we'll see if we can get around to them. I guess the first question to ask is really, I assume you've gotten the shot already. So, what were your side effects that you experienced, Linda, when you were getting the shot?
In the first shot, I didn't feel anything. The second shot, I felt really tired for 2 or 3 days, and I had a lot of joint and muscle aches. I had maybe a fever for a couple hours, but then they all went away and they're fine.
Yeah, and those I hear are pretty common things, right? For me, it was my arm. My arm was so sore, everyone. It was just like being punched in the arm a couple of times, and it was just sore for a couple of days. I hear that's quite a common one. So maybe that's something to think about too. Maybe not do it in your writing hand, something on the side that you like to sleep on. That's a small tip for all of you out there. It's interesting because when we were doing this show, we also got some feedback on why we're focusing on side effects, right? Shouldn't we be, concentrating on how effective the vaccines are, which is somewhat true. And I think that's a good point. And yeah, to answer that, I think, absolutely, we'll continue to focus on the effectiveness of vaccines because they really, really are amazing. But I think it's also important for us to have conversations like this on things like side effects, right? And because it helps us, understand how vaccines work. It helps reassure us if we feel things after we're getting the shot, and also helps, us plan our week, right? In case we might come down with something the next day, we can sort of build that into our schedule. So I think that's really important. And Linda, I think physicians, because physicians really got the shot first. And I think physicians have been doing this really well. I noticed, the first thing y'all did was, do that vax selfie, which is great, with "this is our shot" hashtag. But then, you were saying the day afterwards, I was feeling this side effect, I was feeling that side effect, or this is how it's going, or it's completely fine, right? Tell us about that, like sort of the communications physicians have been doing around, you yourselves getting the shot and why that's important.
I think it's important that patients have trust in the vaccine. And I think one of the best ways I've been able to convince patients of them was telling them I myself received it and I didn't have any problems. So I think all these selfies go to showing how much we actually trust the vaccine.
Yeah, I think that's a really important point. Great. So, want to try some questions? Do you want to get into the questions now on side effects and allergies and anything else you want to talk about? So I am going to pick some out right now. I guess, does the vaccine, this is from Rebecca, does the vaccine cause a flare up in people with autoimmune conditions?
No, it's highly recommended for people with autoimmune conditions to get the vaccine because they are higher risk if they do develop COVID. It does initiate an immune response, but the way the vaccine works, it's so targeted that it's not going to make their autoimmune diseases worse. The way the vaccine works, it creates a spike protein that's specific for the COVID virus. So the immune system is only attacking that, it's not attacking the whole body. So it is safe for people with autoimmune diseases to get the vaccine.
Yeah, that's really important. And I know we get with this is a question we get a lot too, actually, from Megan is, what is the safest vaccine for those with history of severe reactions to injections and shots? That's an interesting question, right?
I think they're all pretty equal. I think there's a lot of media around about the allergic reactions, and there's been a few cases of severe allergic reactions. But people who have things like seasonal allergies, they're not at risk. If you've had an allergic reaction to an injection in the past, it's still okay to get the vaccine. Just let whoever's giving you the vaccine know. That way they'll observe you for 30 minutes rather than 15 minutes. And they have all the medication on hand to treat you if you do develop an allergic reaction. But regarding which one's going to cause an allergic reaction, which one's not, they're pretty much the same in that regards.
Yeah, absolutely. So Jamie has a question. Is there a correlation to vaccine side effects and efficacy? And I guess I hear this question a lot, right? Because everyone's, after they get the vaccine, they're comparing notes and saying, oh, maybe, I got a really bad sore arm. Maybe someone else got nothing, right? And maybe we had it worse for the first or the second one. So I think that's a good question, right? And what would your answer be for that?
It's really different from person to person. I've seen people have no side effects at all, but it works. It doesn't mean you have to have side effects in order for the immune system to be working. It's just different for every person.
Yeah, I think that's really important. And I think it's a very natural thing, right, to sort of compare notes around people we know and sort of compare experiences. But, from the clinical trials, they didn't see any correlation between side effects and how well the vaccine works. Basically, the vaccine works really well is the main thing that we need to know. And when it comes to the immune system's so complex, right, is that everyone has such a unique immune system in many ways. And so the side effects that we experience, and in medical history, right, that the side effects that we experience are going to be different, and that's sort of hard to tease out. I think that's really important. We get a lot of this question. We get a lot too. Is the safety and benefits of the vaccine for pregnant and breastfeeding people? Thank you, Monica, for that.
It seems to be safe in pregnant people. What we've seen in clinical trials, we didn't see any adverse effects in people who are pregnant. the technology used, it makes sense that it's safe in pregnant women. And we've seen cases now where pregnant women who received the vaccine, their babies were born with antibodies. So it seems like it's a good thing for pregnant women to get the vaccine. Pregnant women also, if they do get COVID, they have the risk of ending up with worse disease and being hospitalized. And definitely that can't be good for the baby either.
Yeah, I think that's really exciting, seeing those studies on breastfeeding, et cetera, and, people are pregnant, and encouraging, because I know a lot of people, that my friends, et cetera, were sort of waiting to see, which is reasonable, right? Waiting to see that data come out. And so we're seeing encouraging data. And so I think that's really exciting. Something that people do ask a lot as well is, like, does taking medicine, I guess this is specific, actually decrease the effectiveness of vaccines? I guess sometimes people also ask the opposite question, right? Can they take medicines to prevent side effects? What would you say to, that concept of taking medicine before you get the vaccine?
Yeah, I know the media was saying that non-steroidal anti-inflammatories can decrease vaccine efficacy, but I think now we've seen that's not the case, so they're okay to take. We don't recommending taking it preventively, but if you do get symptoms after the vaccine, it's fine to take it afterwards.
Yeah, and similarly, Beth asked, should you take something like Tylenol or Advil post-vaccination?
Yeah, if you have symptoms, they're completely fine to take.
Yeah, absolutely. Let's see. Are there specific side effects from the first vaccination that would indicate you should not get the second vaccination? This is something Marjorie asks.
Yeah, the only contraindication, if you have a severe allergic reaction or an immediate reaction to getting the first shot, then you shouldn't take the second shot.
Absolutely. And these, something to that level, it probably should be said that it's very rare, right? That you get severe allergic reactions that prevent, I think in studies, it's something like a couple of people, 2 to 5 people, depending on what vaccine you get per million. So exceedingly rare, I think.
Very rare, yes.
Yeah. What about, rashes? Common question, shingles, rashes. Is that considered an allergic reaction, or is it really just a common side effect? Would it be worse on the second vaccination?
Rashes are pretty rare as well. The more common one is to see a rash at the injection site, around the injection site. Some people think it might be just an immune response versus a hypersensitive reaction. There's been a few cases reported in the media where people had generalized rashes, but these are very rare. So it's not something people should be overly concerned about. And these are things that do go away on their own.
Mm-hmm. Absolutely. I think this is an important one that is asked among a community of people who are dealing with these problems, long haulers, right? But isn't often covered. I think how the vaccine affects or prevents long hauler conditions in vaccinated people who still. I guess the question really is, what does the vaccine do for people who have had long haul conditions, right? Does it improve their conditions? Are they worse off? So yeah, I'll leave that to you to sort of.
Yeah, answer. I think it's really too early to know how it's going to affect it. We don't have any data on this yet, but we have seen some cases where people who were long haulers got the vaccine and suddenly their symptoms are better. So that's very interesting to see what will happen in that.
Yeah, absolutely. And we're hopeful that will be the case, but it really is too early to see that. I see a lot of these patient advocacy community groups, they're reporting and doing this fantastic community organizing work, sort of reporting what they're seeing. And, we're seeing some positive things, but also sometimes some people see some negative things too. And so it'll just take time to really understand what's going on there. So yeah, I think that's important area of research that we should keep following. Great.
I see one question from somebody getting their vaccine tomorrow in New Jersey and what they should prepare. And I think the best way to be prepared is just know what possible side effects you might have. If you do get aches or fevers afterward, you can take Tylenol or ibuprofen and just prepare that this might happen to you. But other than that, there's really nothing that should be done.
Yeah, absolutely. What about if you have a history of blood clots or stroke? Is there a vaccine that's safest to take? Should you be worried about getting the vaccine?
We haven't haven't seen any problems with blood clots or strokes with the vaccines we're using in the United States. I know there was a lot of media coverage around what happened with the AstraZeneca vaccine in Europe. And even
Hmm.
that, they've given tens of millions of vaccines, and they've seen 18 cases of these thrombosis in the cavernous venous sinus. So that's really only a tiny amount. And I think they're saying now they don't think it's related to the vaccine, but they're still studying it. So definitely having clots or the tendency to form clots is not a contraindication to the vaccine, and they're all pretty safe in that regards.
Yeah, absolutely. Yeah, that's something there's a lot of media coverage, so it's an important question. I can definitely understand those questions around that. And Tiffany asked, does the COVID vaccine disrupt the menstrual cycle?
Yeah, again, there was a study that came out in Israel where some women had abnormal periods following the vaccine. But I think after they looked at it, they didn't feel it was vaccine related. And I don't think we've really seen this side effect reported, but time will tell.
Right. Yep. Like a lot of these questions, time will tell, right? Um, so here's a science communication that we got from Laura. Please explain to people the research behind this vaccine and why it's safe, not a rush job. I know that's something that people worry about, how it was, it was such a quick process in some ways, but there's a bigger picture, right, to that.
Yeah, so people think, no, COVID, this is a new virus, but coronaviruses have been around for a long time. And the NIH was actually studying how to develop vaccines for coronaviruses since they saw the SARS outbreak in China. I believe that was 2002. And what they
Mm-hmm.
developed was a prototype coronavirus, and they tried to make a vaccine in case we do have a pandemic develop. So this was already researched and the technology in place. So once we did get hit with the pandemic, it was all set up to kind of target this vaccine to the COVID virus. Also, the mRNA technology has been pretty well studied for other treatments of
Yeah.
things like rare diseases, genetic diseases, cancers, infectious diseases. And this has been studied for decades. So nothing is really new about it, just the COVID part of it.
Mm-hmm. Absolutely. Yeah, it's important. And I think a lot of the things that really help speed up the vaccines are the fact that this is such a global problem at the moment. And so it's a lot of the infrastructure. If you focus everything on trying to do science leading to this one thing, it sort of speeds things up, right? And more money invested, more infrastructure invested. And so that's where we are. And, it's really amazing the things that science can do if we really support it. So I think that's what the vaccines really are a testament to. So I think that's a great question. And it's an important thing that we do have to address when we're talking to our communities, because I think that's a very valid question, right? Because we were hearing at the start of the pandemic, it might take several years to do this. And suddenly we have these amazing vaccines, a few months later. So I think that's a great question. Joyce asks, any indication of how long a vaccine will protect against the virus?
Yeah, still, this is pretty early to say, but I think the latest that I've seen come out, we know it probably is effective for 6 months, but now I'm seeing more a year, and we don't have any data for after that time frame.
Yeah, that's right. That was, I think, this week, Pfizer released some information about, what they're seeing so far in the real world of, looking at like 6 months. It's data that is, we're living through this. We're building the plane as we speak. So we're going to have to see. I know previously from if you're naturally infected with COVID, up to 8 months. So it's probably longer, but we're just going to have to hang on a little bit, but all indications are it's good, and it's going to be, right now we're really focused on getting those cases down. So everyone should get the vaccine as soon as it's you're eligible and you're accessible to you. So I think that's really important. All right, I am scrolling the questions. Please keep the questions coming in. I think these are really fantastic questions. So appreciate your questions coming in.
Yeah, I see one on the juvenile version of the vaccine. I think
Yeah.
Pfizer just came out with a study that it's effective for 12 to 16-year-olds, and they applied for emergency authorization use, and now they're starting to study younger kids, so it should be coming out soon.
Yeah, that's right. And I think Anne had a similar question too beforehand. Like, are they safe for teens to take, right? And I think in that study that they released, it's like the side effects they see are pretty much like adults, and that's something that we expect at the moment. So
And
it's looking good, right?
yeah, they're reporting it's almost 100% effective in teens.
Yeah. Although with all of these things, we have to sort of see more data come out. But very encouraging. And I know this is a common thing because people are keen to get their kids vaccinated. So, we'll have an answer to that soon, I think, which is really exciting. Great. Oh, someone got asked this question, and I'm not sure if you have an answer for this. Why did a person who administered my vax ask if I had seasonal allergies? Is that just part of the normal medical protocol of asking before you get vaccinated?
Probably
Yeah.
has more to do with media coverage, how they're making a big deal. If you have allergies, you're more at risk for an allergic reaction. But it's not has nothing to do with seasonal allergies. The vaccine is not plant-based or pollen-based. So if you have seasonal allergies, there's no problem.
Yeah, absolutely. Oh, yeah, this one's interesting. I read that people who had COVID-19 before, were infected before and recovered, have more severe side effects when you get the vaccine. Is this true?
I haven't seen that. I've had many patients with COVID get the vaccine and they don't have more side effects. But then again, I think we're still waiting for more data to come in about this.
Yeah, absolutely. Cool. And I think we're gonna sort of wrap it up here, but I love this comment from Sarah actually. Is one side effect I notice. As soon as the shot goes into your arm, you feel a sense of empowerment and excitement. That's probably not based on clinical trial data or anything, but that is absolutely true, right? That is a valid effect of the vaccine.
Definitely. And I think many people were trying very hard to get the vaccine because the rollout was a little bit skewed. So they get a big sense of relief once they qualify and actually get that vaccine.
Yeah, absolutely. Before we let you go, and thank you so much for answering our questions today. That was so super helpful. And please do keep the questions coming, and we will address them in future episodes as well. We're here to help answer questions because I think that helps empower us and keeps our community safe. So keep them going, please. Anything else you want to add in terms of people who are sort of thinking about getting a shot, maybe worried about side effects or allergies and are sort of on the sidelines and waiting to see what happens? Would you have sort of any advice for people like that, or how to speak to people that you love who are in that category?
I have a lot of patients ask me which vaccine they should get, and really any vaccine that's available to you, you should get it. We're seeing a lot of variants now, and the more variants we see, there's a chance that vaccines may become ineffective. So it's really important everybody get vaccinated as quickly as possible. The side effects are pretty mild the last couple of days, but if you get sick with COVID, you can end up in the hospital on a ventilator or even die. So bring your questions. I'd love to answer your questions. I'd rather you ask me, and maybe I don't have an answer, but I want you to get the vaccine, and I want you to be comfortable to get the vaccine.
Yeah, that's great. And maybe you could sort of talk about your work, both, doing outreach and communication, and with This Is Our Shot, which is an amazing coalition of physicians, right, who are doing great outreach about the vaccine at the moment.
Yeah, so I've been advocating for all kinds of vaccines for a while, but I never felt there was such a need to get the correct information out there. I think a big problem is that COVID became politicized very early when it
Right.
came here, and I think we need to put politics away regarding this. This is a public health crisis that we're having. I know
Absolutely.
people are believing different things, but we have to really help people to trust the vaccine and be comfortable with it. And we have to understand like things that are unreasonable for us, people are really believing it. So we need to know where people are coming from and we need to know how to talk to them on their own terms.
Absolutely. All right. Thank you so much, Linda. Where can people
Thank
find
you.
you? I know you do a lot of stuff on Twitter. How can people
Mhm.
find you on the web, on Twitter or other places?
Yeah, so the best place is Twitter. It's at Dr. Linda MD. You can find me there.
Awesome. Yes. Go follow Linda and ask her questions. As she says, we're all here to help, because it protects all of us. So really appreciate you coming on, and thank you for all your work.
Thank you so much. I enjoyed being here. Bye-bye.
Thank you. Bye. All right, that was fantastic. Thank you so much again for your questions. As I said, keep them coming because we'll keep addressing your questions as we go through this rollout. I think it's really important to have these conversations because it really helps all of us. Now, every week, onto this week's Fauci Fave, where we highlight great examples of science communication on the pandemic. And here, this one is sort of an oldie but a goodie, and it's very, very relevant for this point in the pandemic still.
The pandemic isn't over just because you're over it. The pandemic isn't over just because you're over it. The pandemic isn't over just because you're over it. Let me tell you again. The pandemic isn't over just because you're over it. The pandemic isn't over just because you're over it. The pandemic isn't over just because you're over it. The pandemic isn't over just because you're over it. The pandemic isn't over just because you're over it. Don't be a dumbass.
Thank you. That is this week's Fauci Fave. Well done. Thank you so much to Heather Keelan for making this amazing TikTok. Please follow her. We'll leave her TikTok profile in the comments. And yes, this is 100% spot on. She made this last fall or at late summer, and it's several months later. It's still so relevant. The pandemic isn't over. The vaccines are amazing, but in the US, we're making great progress in getting shots to people. But you know what? It's still going to get some time to get to herd immunity. And with the variants around, we're seeing another surge in Europe. And now we're starting to see the start of another one in the Americas. And this translates to several states in the US where cases are going up again, as we spoke about in New York, in New Jersey, in Michigan. But we're starting to see this in several areas right now. And you know what? We know what to do. We know we need to support our vaccination efforts by continuing to observe other public health measures like masking and avoiding large indoor crowds. So, whilst people are trying really hard to do this, I think the sad thing is that a lot of states, the leadership, are going against the science by relaxing measures way too early. And so we'd really like to call on you, our community, to get in contact with your governor and ask them to listen to the science, to keep COVID protections in place. We are doing a great job with vaccinations, and we are so close. The vaccines are helping, but we just need to hold on just a little bit longer. And if we can do that, we can really get through this. But we need our political leaders to be in line with the science. So please contact your elected leaders because we need to get them to follow the science. All right, and on to this week's Boost of the Week, where we ask you all to share information about vaccines on social media. And this week's boost is, how did you feel after getting the COVID vaccine? #vaccine booster. Now, as we talked about earlier, it's really helpful to share experiences about side effects to reassure people who might be thinking about getting the vaccine, to help them understand how the vaccine works, and to help people plan their weeks. So thank you so much. I saw in the comments when we asked, y'all for questions, you shared about what your side effects were. And I think people are still doing it in the chat. So really appreciate that. It's really helpful, and we should keep having these conversations with our community. So also post it online so that, the people who you're connected with can see what your experience has been. And, again, a valid answer is also that you might be feeling amazing and empowered. And I think that's something that's great for people to hear from you too. And before we go today, I'd like to remind you to sign on to our big Let's Get Vaccinated training, where we're going to help teach you about how to do effective conversations around vaccines with your community. We all have a role to play in ending this pandemic and keeping our community safe. And one of the best ways we can do this is through the power of conversations and organizing. We're super excited by this training because we're going to be doing something really new and unique to really rise to this challenge that we find ourselves in. And that is bringing together the best practices in science communication and pairing that with proven techniques from community organizing so that we can scale the conversations and reach and get more people vaccinated and help bring about the end of this pandemic. So super excited to bring, all of that thought process and different methods that we know work in different fields to really get those conversations out there and do all that we can to protect our communities. So that is happening on April 21st. We're going to leave the link in the chat. And this is part of our big Earth Week, where we're going to have multiple days of live streaming with experts on all of these areas of science and justice that we are working on. But the big day for public health is on Wednesday, April 21st. And we're so excited to have you all part of this training. And really, we can't wait to organize with everyone and, do this work and get that out there. And hopefully we can all have a brilliant summer if we do this work and to help protect our communities. So I think that's it for today. Thank you so much for joining and participating. And, remember, as always, boosters, facts save lives. So please stay safe and we'll see you all next week. Goodbye, everyone.